Good afternoon, the great NEET PG upcoming toppers, Bahubalis, and the most promising jockeys who are ready to have a great race. हम देखेंगे कौन बनेगा NEET PG पति and Spardaya Vardhathey Vidya to compete, to get inspired to study, to recognize what are our strong topics, where are we lagging behind. That is all the game called as NEET PG preparation. Good to see 35 online. And even if somebody joins little late, no worries. And you can go to this link in order to join the game. Now let us start the NEET PG Paediatrics. Question number 1. Look into your phone. Look into your phone. Yes. Question number 1. Quite a detailed question. You are given 15 seconds time, quite comfortable to answer. A 6-year-old girl comes to the clinic with 2 days history of the fever with acute abdominal pain and mild joint swelling. And her temperature is 102 with a new onset heart murmur. So now the question is, what is least likely investigation in this given scenario? So you should remember, positive throat culture of the streptococcus is unlikely in that situation. Already when post-streptococcal glomerulonephritis has set not much of a role for the throat culture. But leukocytosis, normocytic normochromic anemia, increased ESR, elevated ASO titer, they're all the 2 things which you need to remember. Now, doctor, so in an episode of acute rheumatic fever, throat cultures are only positive in minority of cases is what you have to remember. Now, the next question, which is not considered a major Jones criteria for rheumatic fever. Boom, boom, boom. Who is going to answer? So, whenever we were students, every time we go to pediatrics ward, we used to memorize the minor major criteria of the Jones, because our HOD, Dr. Vijay Lakshmi ma'am, wow, it used to be like an attendance. You tell Jones criteria, you are in Kakatiya Medical College in those days. So good to see 39 online and racing. Let us see who is going to win that 40,000 rupees prize. Arthralgia is a minor criteria. Certain enhanced chorea, subcutaneous nodules, erythema marginatum, carditis. Carditis is most common and the early presenting feature, but sedum enhanced chorea is very late, is what you need to remember. Super. Y has scored very high, followed by Radhe, Abhi, Basha, Sakshi. Now, doctor. Question number 3. Of the following, which is the feature which is seen in both bacterial endocarditis and also acute rheumatic fever? You have to be very, very sure about. Both bacterial endocarditis and acute rheumatic fever. In both of them, you see, absolutely, congestive heart failure is the only thing which is common to both. Most of you wrongly answered as subcutaneous nodules. You need to be doubly careful. Game is on the top. Very good. Now, the next question. We have 43 players. I want 100 plus in this tournament. If the dietary iron is not provided, the infant begins to deplete their iron stores. By what time? Come on, punch your answer, doctor. So they typically deplete by 4 months. Absolutely right. That keeps game on the top, followed by Pseudomonas. Rekha is really making a good progress. Question number 5. Once more, enlarge the photograph. There is hypotonia in infancy, and there is an obesity, variable mental retardation, characteristic faces, small hands and feet, hypogonadism. You should recognize what is the syndrome I am talking. Absolutely. It is the Prader-Willi syndrome is what you need to realize. So, Dr. Prader-Willi is caused by the loss of paternally inherited chromosome 15q11 is what you need to remember. So, the spirit of the game is you have done this question wrong. Immediately, you need to go back to the reading room, open up the laptop, go to the online MBBS.com video library, go to the Paediatrics. Under that, there are a wonderful discussion on Prader-Willi and everything about, okay, on the genetic syndromes where there is the phenomenon of imprinting, etc., etc. Now, doctor, the next question. Question number 6. Question number 6. So you should remember there is this typical patient who has got a severe mental retardation, seizures, ataxia, puppet-like gait with a happy disposition and uncontrolled laughter like Ghatotkacha. What is your answer, doctor? Yes, absolutely. Maternal chromosome 15q11. So, Amma will give you Angelman syndrome. Papa will give you Prader-Willi syndrome is what you have to emphatically remember. So very good. That keeps game on the top. Now, question number 7. Very good. We have 45 players online. The patients who are deficient in early complement elements, they have a susceptibility to what? What is their susceptibility? Come on, boom, 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 punch you an answer. Very good. So, doctor, encapsulated bacteria, absolutely right. Absolutely. Very good to see Suresh and many more who are all online. So, please, those who have recently joined, I'm giving you the WhatsApp link. Please join by clicking on this WhatsApp link. You will enter into our WhatsApp quiz group and you will get the quiz link posted before the show starts. Okay, so you can also tell your friends to join this jackpot. Very good. Game lost it. Why? Rekha, Abhi, Pseudomonas correctly answered. Super. Now, doctor, the next question, high adrenaline pediatric quiz, late complement deficiency. What are they susceptible to? Virus, fungus, bacteria, intercellular, extracellular, protozoa, gonococcus, capsulated, not capsulated. Come on. Punch your answer, doctor. 47. Excellent. You got to punch very fast. So that's good. Gonococcus and meningococcus like capsulated organism infections are more common when the terminal complement components are deficient is what you need to remember. That's good. Game is on the top, followed by Y, Radhe, Ron, Rekha. Oh, all are completely rocking the game. Now, question number 9. So you should remember a patient presents with recurrent infections with Staph aureus and Serratia in the form of cutaneous abscesses, lymphadenitis, pneumonia, empyema, perirectal abscess. Where is the defect? What is the disease? Come on. Excellent. Chronic granulomatous disease with NADPH oxidase deficiency. You should remember. Once more, in the online mbbs.com video library, we have 953 topics, 3,000 video lectures. Go to the microbiology. We have discussed excellently about primary immunodeficiency and acquired immunodeficiency. Invariably, one question comes. Are you all getting ready? Yes. So, doctor, the next question. That keeps game on the top. And quickly, Vardhathey is picking up. So, NADPH oxidase plays a very important role in the production of ROS. And any defect of it will lead to the chronic granulomatous disease. Now, doc, question number 10. The most common bacterial pathogen for neonatal osteomyelitis. Who is going to correctly answer? Neonatal osteomyelitis. Come on, doctor. Very good. Neonate. So you should think neonatal infection. So group B Streptococcus, E. coli, Staph aureus. You need to remember. Okay. So in NEET PG exam, there are about 10 to 15 questions in pediatrics. I want all Dr. Murali Bharadwaz Super 1000 batch. 15 out of 15 mark ke baar nikalna hai. Ron is on the top. Let us see. Abhi and Rekha, you are doing really good. Still 17 questions. Now, expand the question. A 9-year-old boy presents after a camping trip with the Boy Scouts 1 week ago. He is fairly toxic with fever of 39 degrees, headache, myalgia, nausea, vomiting, erythematous, macular rash on the wrist, ankles, proximally on the trunk. What is the best treatment that you want to give? So all these infection, rash causing disorders, you have to be very sure, doctor, tetracycline. So what are all the conditions where tetracycline is the treatment of choice? Where aminoglycosides are treatment of choice. So in pharmacology, there are about 1200 MCQs. Past 15 years of AIMS, All India PGI, JIPMER, NEET PG, DNB, we have discussed in about 40 hours. So please take a chance to subscribe to onlinembbs.com and do the revision. Very good, Ron, you're doing great. Question number 12. Of all these following defects, oh, easy question. Come on, we want to make you happy. अगर ये भी रॉन्ग करे तो आपको फ्री में मैं कोचिंग दे देता हूं. It's my social responsibility to take care of you. If you have done this question wrong, you will get a free coaching. Oh my God. Pulmonary stenosis is the most important of all the defects. Overriding of aorta, VSD, right ventricular hypertrophy. Come on, मेरे प्यारे भारतवासियों. टॉप का abnormalities में भी wrong कर रहे तो आप amoeba stage में हैं. Okay, so doctor, that is wonderful. Y is on the top. Al-Khamenei, अरे Al-Khamenei साहब कल topper बन गया. But he did not claim his free subscription. Please do that, Al-Khamenei. We are waiting for you to send the screenshot to our helpline so that we love to activate your account freely, where you get 3,000 video lectures, 30,000 MCQs topic-wise, 1 lakh PowerPoint slides of notes, 65 full-scale grant tests and discussions, everything, right? So, doctor, that's wonderful. Why is on the top? Question number 13. The most common congenital obstructive lesion of the left side of the heart. Most common congenital obstructive lesion on the left side of the heart. Very good. Boom, boom, boom. It is coarctation of aorta is what you need to remember. Coarctation of aorta. Now, doctor, Busky is saying that, sir, it is difficult to read a full case scenario in 20 seconds. That is what the doctor, 20 seconds में diagnosis करना है, वो practice मिल जाना है, main catching point को पकड़ना है. That is the practice. For a period of time, you will get the habit. You play 100 quizzes with me, you will automatically get that practice. Okay? Now, doctor. Very good. Radhe is on the top. Now, question 14. We reached half the race. Come on. Punch your answers. So, when classifying the growth plate fractures extending obliquely to the metaphysis, across the physis, and into the epiphysis, what type of Salter-Harris type is this? Oh, only 11 of you correctly answered. It is type 4, Salter-Harris. Once more, if you have done this question wrong, a 200-page book lagao, Salter-Harris, I should read right away. That is what you have to keep. Okay, doctor? Entire medical career, don't expect somebody to teach. Nobody can teach medical students. If somebody said, I'm a great teacher, I taught and I made somebody to become topper, impossible. Somebody can inspire you to learn. It can be a classmate, it can be your senior who failed in entrance, it may be your junior who is very bright and brilliant, it may be your girlfriend, or it can be boyfriend's girlfriend, anybody. So you have to be doubly sure from where you get that source of inspiration. In my opinion, by these quiz tournaments, I want to bring across India all aspirants to one common place, fight with each other, inspire each other. That is the best source of inspiration. Once you got inspiration, once you know where you are going wrong, to correct that areas of weakness is no time, right? So keep playing the quiz tournaments consistently every day. Question number 15. Yes. Look into your smartphone. A child developmental assessment of a 3-year-old girl shows that she is able to dress herself, and you would classify this kind of a developmental problem as what? Very good guess, 14 people. I appreciate. Constitutional developmental delay is a good guess, but developmental dissociation, this is called as. Okay, let's talk about this condition. I know most of you will wrongly answer. See, normally children of 3 years of age should be able to use 3-word sentences. And they have a vocabulary of approximately 250 words. So her language skills are developmentally delayed. But her motor skills are appropriate to her age. So there is a substantial difference between these two skills, motor and language, and that is called developmental dissociation. Developmental deviancy क्या होता है? Typically development is happening but in a non-sequential order. मतलब anatomy में fail हो गया मगर surgery में distinction आ गया. So non-sequential order. And constitutional delay, when do you call? Both motor and also language skills, both of them, if they are delayed, you call constitutional delay. समझ में आ गए ना, Dr. Babu? Very good. Now, the next question. Question number 16. With regard to the torch infections, neonates usually acquire this infection during delivery through the birth canal, right? So, which one is that? Which one is that? Very good. Correct. It is the herpes simplex. Vertical transmission at the time of birth is very high. So that keeps Ron, Radhe, Rekha, R. So let us see who will be the winner. Question number 17. The vaccine against Neisseria meningitis is currently recommended to all the following population, except, boom, boom, boom. Who is going to give me the correct answer? The vaccine against Neisseria meningitis. It is given to the persons in military, persons with asplenia, lacking complement factor C6, not to a 2-year-old child. Yes. So that keeps Ron on the top. 18. In which age group meningococcal disease is highest? Punctual doctor. So those who are joining a little late, you can still join any time in the middle of the quiz. I am typing here the link to our WhatsApp quiz group. I want you to join the quiz group. It is free. Obviously, WhatsApp is free. But before the start of the next quiz, 7 p.m. we have a quiz on psychiatry. Hum psycho banenge. Or 25 questions rapid fire khelenge. Especially anesthesia, psychiatry, dermatology, radiology. We think they are small subjects, but 5 into 4, 20 marks, doctor. They have a huge impact. So that is the reason we keep having. For 9 o'clock, Dr. Haritha is going to make you vibrantly fighting on pathology quiz tournament. Please become part of it. Okay, so 0 to 4 years is the time where meningococcal disease. So Ron is having 842 points. Oh my God. Now, so infants are more susceptible because the immune systems are not mature and they start losing their maternal antibodies and they become susceptible. Now, the next question, doctor, question number 19. Expand the image and check. So, a 15-year-old boy comes with reactive airway disease. And he is experiencing nocturnal symptoms approximately 2x per week. Spirometry shows FEV1 by FER, PFR, 75% of predicted. How do you like to classify bronchial asthma? देखो डॉक्टर, बच्चों में क्या होता है? जरा common cold, bronchiolitis, जरा एक अस्थमा, नहीं तो chicken pox, some rash causing illness, छोटे 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 upper respiratory, URTI, पूरा पेन का इंक निकल जाता है pediatrics DCH वालों को लिख के OP में बैठ के. But for the parents, when a child is sick, for us it is a routine. 200 people we will write URTI and treat them. The mother loses her sleep. she become irritable, especially with 2 children, 3 children, right? And the father working in the office will be thinking, oh God, I will stop having a drink. Please see that my son's fever is gone. He will keep making promises to the God and make a deal with the God. So the life is a bigger drama, right? So you're all born to become those great clinicians day in and out. That's the reason you are not ordinary being medical students. You are extraordinary creation of the God. And extraordinary people should not talk about things like anxiety aa raha hai, tension aa raha hai exam ka, mujhe milega ya nahi milega, kyun nahi milega, jarur milega, Murali Bharadwaz ke saath roz khelo. So doctor, let's go to the next question. Good to see 43 players. Ron is on the top. Now, moderate persistent symptoms. Kab bolte? Daily with more than 1 per week. Nocturnal symptoms and FEV1 by PEFR of 60 to 80% are predicted. Severe persistent means daily limiting the physical activity with frequent nocturnal symptoms. FEV1 by PEFR is less than 60% are predicted. Like that, there is a classification given. Every book mein rehta hai, but idhar ke book mein aana hai, Dr. Babu. Next question. Question number 20. What is true about otitis media? These are all true about otitis media, except with regard to the treatment, bottle feeding, etc., etc. Very good. 10 of you rightly answered. It's in fact a relatively easier question. So, doctor, Ron is on the top. Very good. So, simple acute otitis media, you will treat it with amoxicillin orally. Alternative is trimethoprim sulfamethoxazole. If very resistant, you will give clavulanate plus amoxicillin, 2nd or 3rd generation cephalosporins, or a macrolide as the treatment. Question number 21. Downs syndrome. Most of you will correctly answer. Downs syndrome. It is not associated with. Come on. Boom, boom, boom. It is not associated with. Absolutely. There is a transposition of 14 and 21 chromosome. Epicanthal folds, increased risk of leukemia and early onset of Alzheimer's, and there is a trisomy 21 in Downs from maternal disjunction. They're all true. Okay, so now next question, doc. Ron is on the top. So radial aplasia is not in Downs, but it is strongly associated with Edwards syndrome. Trisomy 18 is what you have to remember. Question 22. What is incorrect about congenital syphilis? Punch your answer, doctor. Incorrect about congenital syphilis. So, each of the stages of syphilis, what is the percentage VDRL is positive? All these things you have to be very sure about. Majority thought it as D, but only 8 of you correctly answered. So, doc, Abhi correctly answered. So the tertiary syphilis is the most dormant of all the stages, whereas primary and secondary syphilis are more likely to produce the infection in the fetus. That's what you should remember. Now, Question 23. About the HIV positive mothers, what is a correct statement? Once more, maternal HIV is a common topic in 4 subjects: microbiology, preventive medicine, pediatrics, general medicine. You have to be perfectly sure, even obstetrics. So such common topics, not doctor, out of 953, there are some which are common to many subjects. You should never do a mistake. So breastfeeding is not permitted. Of course, that is a recommendation in developed countries. In developing, it is still permitted. Now, that keeps Vardhathey closely coming to take away the 40,000 rupees prize from Ron. Let us see. So, since HIV is excreted in the breast milk, the mothers are advised to restrain. Zidovudine has no teratogenicity. In fact, it is well proven that it helps in reducing the vertical transmission of HIV. Okay, now, doctor, the next question. Question 24, we are reaching towards the end of this horse race. Yes. Punch your answer, doctor. A teenage boy presents because of a decreasing school performance. Oh my God. And increasingly labile mode. Mom says, it seems confused much of the time. And he is jaundiced, tall, thin, mild hepatomegaly, occasional fissure. Oh, itna bolne ke baad. That keeps Ron on the top. So, decreased ceruloplasmin, occasional fissure rings, etc., etc. Now, doctor, the next question. Yes. A 15-year-old presents after referral to you for proteinuria. Urinary albumin shows 1+ proteinuria, no edema, normal cholesterol. Urine protein creatinine ratio is 1.48 and quantitative protein is 25, normal 2 to 10. What is your diagnosis? Absolutely. Only one correctly answered, one and only one. There is an important clue for you to make a diagnosis of benign orthostatic proteinuria here. I'll tell you what is that clue. But let me quickly check who is my one. Mera wala one kaun hai? Arre game ne correctly answer kiya. Very good game. So doctor, if urine protein creatinine is less than 0.2 and if the patient is asymptomatic, then it is a benign process that corrects itself by lying down. So that is the way to recognize. Only game could correctly answer. Superb. So after this session is over, under this video, please leave your comments. Did you like the quality of questions? Did you like the overall theme of the quiz? Do you have any new suggestions? Most welcome. I love to see the comments. Not now. In the chat box, anyway, you will chat. But below, after the video get published, below, you have a place where you can write comments. Please write comments. I love to listen and learn from you. Right? So, typically, it is autosomal dominant. Autosomal dominant. All the description given to you, Dr. Ron is on the top. Tuberous sclerosis ka description. All structural protein disorders are autosomal dominant. All rate limiting enzyme protein disorders are all autosomal recessive. 27 of 28. Come on, punch your answer. The new mother of a 3-week-old infant is concerned that her child is having difficulty breathing. She says he is a noisy breather, but he is febrile and he sleeps well, feeds well. And what do you want to do in this given case? You need to reassure the mom and send home with a saline nasal spray. Okay? So, Ron, Radhe, Rekha. In the middle we have Y. Let us see who will win. 48 online players. हम बहुत खुश हैं, बहुत खुश, very खुश. So Prachi, Abhi, Milky, Akshi, Pseudomonas, Bahu, Anukya, Basha, Suhu, Oddity, wow, Gunasundari, Pravalika, Harita, Sakshi. Thank you all for joining the quiz, doctor. Please keep playing the quiz. So noisy breathing of infancy is secondary to obligate nasal breathing. So finally, to decide the winner and 40,000 rupees winner of today's quiz, a 15-month-old female infant is noted to have breast buds, genitalia in Tanner 1. What you want to do? This is going to decide who gets that, which jockey is going to get that 40,000 rupees worth of online MBBS.com video library. Whoa! 19 of you correctly answered. Reassured mama that it is a benign process is what you need to remember. So there are a lot of findings in newborn which are self-regressive in nature. We have discussed all that in the Paediatrics video lectures in the online MBBS.com. Ron! Jindabad, Jindabad, Jindabad. Ron is the winner. Ron, take a snap, send to our helpline. You will get online MBBS.com video library, 65 full-scale grant tests, 3,000 video lectures, 1 lakh PowerPoint slides, and many more. And Dr. Murali Bharadwaz, all yours. Okay, so thank you everybody for participating in this edge of the seat excitement. Learning is supposed to be a game. We should play it, we should enjoy it, and at the end of every tournament, we should know how can we be able to improve and fill those gaps. So that is the whole purpose, doctor. And I want to see all of you 7 p.m. Psycho banenge, our psychiatric quiz khelenge. Then 9 p.m. you have Dr. Harita's pathology. Every day night 9 p.m. you have Harita, our excellent quiz master. And Dr. Harita is going to start a quick refresher course, live online broadcasted. So you can subscribe to her 15 hours mein pathology master karo program by Dr. Harita. And the fee is 1,500 rupees. You can connect with our helpline and can be able to buy the subscription. It is planned on the upcoming weekend, Saturday and Sunday. Okay, so see you all at 7 p.m. Thank you.